ill. And we were dealing with that before the surge. And then on top of that now, this huge surge of COVID patients. And we don't have the space. And we are all so tired of telling loved ones that they're losing their loved one.
These patients that you're seeing because of COVID, are they almost all exclusively unvaccinated?
So my experience, I can only speak to my experience in my hospital, which is the main campus. And yes, every patient that I admitted to my service in the ICU and have seen through the ED who is critically ill is unvaccinated.
We know Delta is still the biggest problem here in the U.S., which explains this latest surge, but we have the Omicron variant too, spreading rapidly around the world in places like the UK right now. The British Medical Association is warning that tens of thousands of medical staff could soon be out sick with COVID by Christmas Day, they say. And as Omicron cases are continuing to rise here in the U.S., I wonder if that's a big concern of yours, given the staffing issues that we know hospitals are facing right now.
I can really only speak to my experience. I have not seen any more colleagues go out with COVID recently than in the past. But yeah, I mean, staffing shortages are concerning for a number of reasons. I think the people who are left are hanging on to hope that this will get better. And so every wave hits us a little bit harder.
What do you need right now?
I've been thinking about this a lot. I've been asked that a lot, and I know that I'm not going to be able to convince everybody to get vaccinated. I can't change people's minds. I wish I could, and I wish I could show them what we're seeing, and maybe that would change their mind. But we have had to tell more people in the last 20 months that they're losing somebody they love than anybody has ever thought they would have to tell in a lifetime of medicine. And so we need kindness, we need support, and we need unvaccinated people to take steps to protect themselves so that they don't end up at our doorstep.
Well, thank you for all that you do. Dr. Jacqueline Flem-Carlson, I really appreciate you taking the time to share what you're seeing and what you're experiencing. Sending our best to you and all of your colleagues, giving you strength to get through this next wave.
Thank you, Anna.
I want to give you a better sense of how other countries are coping with COVID right now. The Omicron variant is spreading quickly, especially in Europe, forcing new restrictions, something we haven't seen since the worst days of this pandemic. CNN reporters are following developments from across the globe.
I'm Elliot Gotkin in Jerusalem, where Israel is adding 10 more countries, including the US and Canada, to its red no-fly list as it braces for the full force of a fifth COVID wave. From 5 p.m. Eastern Time on Tuesday, these countries will be off limits for Israelis unless they get special permission. Travellers arriving from them will have to self-isolate for 7 days, first in a designated quarantine hotel, and then, once they get a negative PCR test result, at home, so long as they agree to have their movements tracked. Israel has been steadily adding countries like the UK, Italy and much of Africa to its red list to reduce the spread of the Omicron variant. Most of Israel's 175 confirmed cases and 380 suspected ones recently returned from overseas. On Sunday evening, Prime Minister Naftali Bennett held a televised news conference imploring Israelis to take the new wave seriously and encouraging those employed in the private sector to work from home. Public sector workers are expected to follow next week. He also sought to reinvigorate Israel's stalling vaccination campaign, especially among children, where take-up has been especially weak. The time we bought is running out, said Bennett. With God's help, we will safely overcome this wave.
I'm Scott McLean. Denmark is already seeing a spike in new COVID infections, twice as high as the previous peak. But now, thanks to the Omicron variant, Danish scientists predict that in the worst case scenario, daily infections could be 10 times as high as the previous record. Danes are quickly finding out that 2 shots of vaccine, well, that's not very effective against Omicron. More than 3/4 of the population has had 2 doses of the vaccine, but only about 1/4 have had their booster. Scientists are also predicting that hospital admissions could hit record highs by Christmas. The one point of uncertainty is just how severe an illness Omicron actually causes. Denmark has already shut down cinemas, theaters, and museums and put restrictions on nightlife to try to get the virus under control.
Yeah, our thanks to Scott McLean and Elliot Gotkin for that reporting. Happening now, closing arguments in the trial of former Minnesota police officer Kim Potter.